Health professionals are asking for people to be cautious for look for potential tick bites this summer. And as Cooper Seamer reports, a South Dakota family is adding their experience to the message.
We didn't think anything about it, actually. I guess we've grown up in the country and never really worried about it.
That was the initial thought of Brody and Brianne Mueller after finding ticks on their daughter Lily 2 years ago after a camping trip. While they didn't notice anything at first, Lily became seriously ill a couple weeks later.
And then it was about 2 weeks later, we took a trip to Minnesota, and she just really wasn't feeling well, wasn't acting herself, really tired.
Lily had also developed a rash around her hands and wrist. She was eventually diagnosed with Rocky Mountain spotted fever, an uncommon but not unheard of tick-borne disease.
There's typically less than 5,000 cases per year in the United States, but kids account for about 6% of those cases, but they actually account for about 25% of the fatality rate.
After being admitted to the Sanford Children's Inn in Sioux Falls, staff quickly started treating her with doxycycline, an antibiotic. Lily did make a full recovery a couple weeks later, but it was an experience that the Muellers say was nerve-wracking.
And so then it took them telling us every day, every hour, it will get better, it will get better, it's hard to watch, she's not getting better very quickly, but she will.
Ticks can also spread Lyme disease, but the symptoms are sometimes hard to spot. If you find a tick and nowadays tasks are feeling like a chore, you may want to check with your doctor. We'll still head at noon if you're catching fish out on the lake. We got a butter almond recipe you'll want to try out this summer.